primary doctor. This is a post radiation surgery appointment. So yeah, we're gonna see what's going on right now. Can get an update on what is to come. Yeah, so she over there signing up and thing. Yes, so just in the waiting room. Really?
Davidson? Yes.
It's a sign, yes.
Okay, go ahead and sign it.
Okay.
There's some right in here.
Okay.
Go ahead.
2 sections.
Uh-huh. American. You, no, that's for us. And then we'll fill that one out together.
I did, this one,
Right. Yeah, we'll
I
fill
don't,
that.
I was on it already.
Okay. All right, step up on the scale.
Why? Skill, you know.
Jane, I checked it this morning.
Okay, you can go ahead and have a seat in the chair right here beside you.
No, this is not right, because this morning. This
Well,
is
what-
one, this is 143.3.
Uh-huh.
So Jane checked and said it's 140, and I don't eat anything.
Well, you have clothes on.
Oh, oh, that's it.
Go ahead and have
I
a
was
seat.
just not a true picture then, because I want to close.
I wouldn't take it. I would go by what it said manually. Yeah, because the manual is more accurate than.
Me too, and let's close when I'm coming.
Well, it does, and I mean, and I'll bet you heard of something.
All right, what arm can I use for your blood pressure?
There's no money different this time.
You make mine up.
And I need one finger.
But I wouldn't take it, that's way too much.
Fingers are cold.
See what it is, are you supposed to take it one time?
All right, get your temperature.
So let's put it.
97.6.
See what it is here, I mean, if it's like flying through the roof, go ahead and take it. Because it's really not that much, it's gonna make a big difference. But I would think, I mean, it's 115 or 2 hours.
Oxygen level is 98%, heart rate is 63.
Okay. All right. Welcome. Bye.
We're just waiting for your blood pressure. Oh, 189 over 81.
No, it was 156 this morning.
Do you
Whenever
have,
I come to the doctor, it's always about 10 or 20.
so I made your blood pressure go up.
Mommy, relax, relax.
Oh, and I took the
Do you
cane.
take blood pressure medication?
Yes, I do.
Okay. Is it okay if I take it again?
Yes, say it
Okay.
again.
Feet flat for me. And take your arm and put it like this.
Right?
Put your arm like this. No, the other arm. There you go. Okay, you ready? Right.
anybody when they say, I've never seen that before.
164 over 73. That's a little bit better.
Yeah.
All right, we're gonna go back to room number 8, so you can come with me.
Right.
Do you have a seat right over there? I have a seat right here for you behind me.
Okay.
All right. Any pain today?
No,
No symptoms at the top of the page.
no.
It says no COVID since your last visit, no new vaccines as of yet, no new history, and you have not been to the hospital or the ER, correct?
What was the last visit? I have been to ER.
ER or the hospital?
What was my last visit here?
I'll look for you right now.
I don't remember.
It's okay.
I came for a follow-up visit.
As soon as it lets you sign on, I'll be able to tell you when you were here last.
Okay.
What's your date of birth?
11/11/1953.
Last time you were here was July 24th, so last month.
Okay.
So no hospital, ER since then?
No, yeah, that's about that.
I'm just putting your vital signs in, okay?
Okay.
Any falls in the past 3 months?
July, August, September. So within 3 months, I had a fall in June, towards the end of June.
June, okay.
June 6,
June 6th?
yes. 6, June to July to August. So I'm still
Yeah, so
in
that's,
3 months.
yeah. So, how did you fall?
I fell after I was trying to come off the bed.
So at home?
Yeah,
Did you have to go to the emergency room for that one?
yes. I was in Jamaica at the time.
You were in Jamaica?
Yeah.
Wow. Did they say everything was okay?
I went to ER and did a scan.
And everything was good?
No, it wasn't good. That is why I returned to America on the 12th.
Okay, and what happened?
And I saw Dr. Polly on the 13th. And she recommended that I go to ER.
Okay.
And I went to ER. And I did the MRI. And the report that she got here was better than the one we got in Jamaica. But she still suggested that I need to see the grading surgeon.
Okay, neurologist?
Yes.
Okay.
I saw the neurologist. And it ended up that I did a surgery.
Okay.
So I completed that process, and I was to see her after the
Alright.
process.
Now you're
So
coming back to see her.
yes, for her to continue her process.
Do you use any kind of cane or walker or anything like that?
No.
Okay. And you can walk on your own, you don't need assistance, right?
No.
All right. Are you still taking the Keppra?
No. Oh, wait, so.
Amlodipine?
Yes,
You have a list?
I'm taking the blood pressure,
Okay.
but I have another one.
Okay.
It could be the replacement for
Okay.
this one. It's it's related to the Kepler.
Mm-hmm. It's another name for it, so I'll put this in. I think I need my glasses. Ooh.
Mhm.
Okay. Are you taking anything else?
No.
So the Nexium you're not taking anymore?
No, this only two things that
Only two things, okay.
The blood pressure, and I take this after maybe twice a day.
Any new allergies to report?
No, not to my knowledge.
Okay. And you said no pain today, right?
No.
She's gonna be in to see you in just a few minutes, okay?
Okay.
You see, every time you come, them ask you the same question. Oh, 4 or 5 times.
That means if anything happened, they'll be able to look back and say, oh, this is what you said every time. And if there's a difference, we can identify that something wrong with memory.
Do you have an on-gas directive? Do you have copy of it ANR? Yeah, so let's hear what she has to say today, because the doctor has something else.
It's to make decision about the radiation and the chemo disease relating to the first surgery. So I'm not too quick at the chemo, so if they want to do the radiation first.
Your peeps, so want to see our primary doctor, hear what them saying now. Yeah.
This is oncologist.
Oncologist.
That is,
Okay. Oncologist. Hi. SPC. Hi to you also. Yes, so again, we're just waiting on the oncologist to come and check this, check out, give us an update on what is happening.
Are you recording?
Mm-hmm.
I want to say something now. I'm not sure.
Just wait till after.
Eh?
Wait till after.
Can you hear me?
Can wait till after.
No. Okay. No, I'm not sure she can come on today. I text her, but she don't answer me. Normally, for it today, I must just record her, call her, and she not really answer me.
Are you still taking the Kepler?
No. Okay, so,
Ambulance?
yes,
Ambulance.
I'm taking the blood pressure.
Okay.
I have another one.
Okay.
It could be the patient for the
Okay.
this one. You know, I'll be busy then, I don't know then.
Let them so them start the page for. Let them so them start the page for.
They got a swimming pool over here. Come.
She taking long to come today. Last time she called.
Hey, wow. I think you have something on your tongue. Show it.
Anytime. I know, she know that you record, and it's just like that, come to play.
You can't cope with that.
So you guys do that when I just said, Shabbat. It was my plan not to have one.
Morning, guys. So this morning we're going.
I used to be wrong.
smoke one?
Yeah, yes.
Okay. Oh, this is stop.
I'm actually thirsty right now, so I'm drinking water.
Water. Big boy want water. Make a garbage food.
So there, what are your plans for today, teaching?
Hey guys, so today we're at home chilling. Mommy just mentioned to me that her medication is done and we need to get medication. But instead of driving to the pharmacy, which is not that far anyway, I feel like what should I should just walk it down there. She need an exercise. Because from the whole surgery and everything, most of the time she just is in bed in the room, not really going out much. Most she walk is either to the bathroom or the kitchen. But most to the kitchen. But yeah man, just gonna take a walk with her to the pharmacy. Already? Okay guys, so guess what? We're on our way to the beach. Yeah, so we're gonna this beach is not going to be anything like the one we have in Jamaica, but we just are gonna work with it. Yeah man, the first stop we're gonna make, we have to make a few stop at first. Yeah, so after that we so this are they ready? We got the okay guys, so today we are going to the zoo. Yes, we're link up with the rest of the family and we're gonna have a fun day at the zoo. Yeah. So subscribe and just follow the journey and stay cool. Yeah. That you don't know what's coming up at the end. But follow me as always.
Okay, guys, so we're just waiting on the oncologist to come talk to mommy, you know. So, yeah, hold on a bit. Hmm.
Puerto Rico.
The longest me ever see she take for coming.
went fine?
It went good and
You did 3 days of radiation?
yes, I have not seen the report. My daughter only look at
Seen the
my
report of what?
results
Of
on
the radiation?
my chart. But from my estimation, it was okay. The process was such. The main part is that I had to be on the bed and keep still for a while.
Oh,
The
while
machine-
they were doing
the
the
machine.
focusing the radiation?
Yes.
Yeah.
And the hardest, it's not really painful, but they made a special mask, plastic mask. that they put
That's
over
a
it.
standard procedure. For
Okay.
everybody, that's how it is done.
Oh, it's the first time I have done it, so.
For everybody who needs brain radiation, that's how it is done. They do the mask and
Yes.
focus. Yeah. So it was 3 doses of focus radiation.
Yes.
And the last day was when? 19th or the
Tuesday.
20th? Tuesday?
Tuesday.
So Tuesday is the 20th.
Yes.
So you started on the 16th and 19th and the 20th. You
Yes.
did 3 days.
Yes.
Okay. So now we are at a point to make a discussion and decision about what to do from here, right? My suggestion was to consider doing at least 3 doses of chemotherapy and then enter into surveillance phase and monitor you closely with the scans. We have removed what we have seen on the scans. That doesn't mean that there are cancer cells that are floating around in your blood. To see any spots of cancer on the scans, they have to be around 10 million cells. Right? You with me, Bernicia?
Yes, I'm listening.
Your daughter is on the phone?
No, I was trying to record for her.
Yeah,
But
okay.
she's not, but
Right,
I
so
was not a certain,
I know you have always been, since I've known you for the past 2.5 years, you did not like the idea of the cancer treatment or chemotherapy or surgery, but ultimately we had to go through various things so far. Having gone through a big brain surgery and radiation, I'm glad you're doing very well. The result, what we have achieved so far, to get benefit of that result, to kill any cells that are floating around before they planted seeds elsewhere in the body, my recommendation would be to consider chemotherapy starting sometime next month. If you say, Dr. Fulluri, no matter what it is, if it comes, it comes. I am not going to consider chemotherapy. I would not push you to do that. You would continue to do the CT scans to follow up and also brain MRI once every 4 to 6 months.
that is what I understood from you from the last year. But when I was communicating with my daughter, she mentioned as if I was going to do radiation before the chemo.
Correct. You finished radiation now. That's
That-
why- You
I'm not
finished
going to do
radiation now.
for your case.
You finished radiation to the brain already
I
now.
know, but really.
But there's no benefit to doing radiation now. You are so far out. Radiation to the pelvis is not done now. You are almost 7 months out from surgery.
But I was in touch with my doctor this morning about whether or not, and I was kind of uncertain, but she convinced me that I should go for it.
For radiation? Back
For the-
then, not now.
No, I'm talking about this visit,
Right.
and I was saying I'm not certain that I should proceed with the chemo that you had just recommended,
Yeah.
but she replied that she think I should go through with it, so.
With the chemo?
Yeah,
Yeah.
so I think I lost for it. Because I'm thinking that she's more advanced medically than me, and
Yeah.
she feels I should do it, so.
So we can always start with one round of chemotherapy and see how your body takes,
Okay.
right? If you don't feel well or it's causing a lot of side effects, at least you've given a try.
Okay.
There are a lot of ways to work around with the side effects of chemotherapy. You have such a beautiful family to help you while you are going through the chemotherapy. There are wonderful nausea medications to help with the side effects. I'm not saying chemotherapy is a walk in the park. right? There are side effects, including some nausea, feeling tired, but that improves once you are done with the chemotherapy.
The concern I have is that right now, I'm not feeling any pain as such.
When you
And
had
I
this
am,
also, you never felt any pain
and
until that
I'm
point.
mobile.
Yeah.
And I feel that while doing chemo, I might get inactive.
If it comes to that point, then we can always say, we have given a try, and you
Okay,
don't want to do second, third, it's up to you.
okay,
And also today, as I'm saying you this, I'm not starting today. I will give you the information on the chemotherapy drugs that we use, and we can revisit again next month. I can submit for insurance approval and everything, get things ready for September.
okay,
And when you come back, my intention is to give you the first round of chemotherapy.
okay. So, in preparation for the chemo, will I have to do any preparation like be on fasting or
No,
whatever like that?
no preparation you need to do. You eat regularly, you take your regular medication as you are doing right now. The only thing I need from you is coming here for chemotherapy.
Okay,
So we give all the medicines that you need here, and I will send the nausea medicines to your pharmacy so that you have them at home.
okay. And it's a whole procedure that you do and go home the same day?
Same there. Everything is here. You are in the treatment room for half a day. They
Okay,
give the IV and chemo goes into the IV.
okay, just to hear what dates you have in mind to see if it fits in with my daughter. Okay, well, that's it if she can't come to.
So I'll print and give you the information on the chemotherapy drugs.
Yes,
You can review it with your daughter, and my suggestion would be to wait until after Labor Day weekend, which is September the 2nd, and do it after the week of September 9th.
okay.
The week of September 9th, we have around 20 days time now.
What do you have in mind?
Any day of that week.
I think she's more available on the weekend.
Weekend, we don't do it.
I mean, when I say weekend, more to Friday, Thursday, Friday.
We could do Thursday, Friday, so I could ask them to look for a chair September 12th, which is a Thursday.
September 12th. That date is special, remind or something. I think September 12th. Okay.
You going anywhere?
Well, no, I'm not going anywhere, it's just that I usually like, when I'm doing these unusual things, like challenges out there, it's me. So I think the Thursday should know how to plan our
Okay,
schedule
got it.
next month.
So the radiation to the pelvis is given only if the cancer was just contained inside the pelvis.
Okay.
We already now know that it's already outside the pelvis and went into the brain. There is no point in doing radiation now.
Okay.
Now the treatment is something that goes all over your body.
Okay.
Radiation, also doing it this far out from surgery, has no benefit.
Okay. And you said you'll follow up with the insurance to see if it's covered.
Correct. So we'll put the treatment plan and send with your pathology and everything for your insurance, and they will get back to us in the next few days. Usually it won't take more than 2-3 days. So before you start the chemotherapy, you need to have what we call chemotherapy education. It is done by one of my nurses. Becky does it. So I'm going to set you up for the chemotherapy education to get a little bit more information on the chemotherapy before you even start the treatment.
Say September 9. I'm thinking that I have some extra persons at the house now. Well, I should have, and they'll be leaving on September 8th, so I wonder if I should have done it earlier.
We could do the week before. We
What
could,
date would that be?
that would be the Thursday before.
What is that day? What
I'll
is it, a
tell you.
holiday? What is it?
So we could do the September 5th, which is a Thursday.
Okay, do it that day, because at least if my daughter is busy, I have some backup person.
Somebody
at
else
home.
can bring you.
Yeah.
Yeah, got it. You know, you were worried about radiation. It's like an X-ray. You don't feel anything. You did fine for the brain.
Well, I tell you, because I've never done surgery before, other than the one that I did,
Yeah.
I didn't know what to expect.
What to expect.
And then, to tell you the truth, I didn't know that medical technology are so advanced now.
Very much.
So there's not much of untouched, but machine is there.
Yeah. No, I'm not saying that we have everything to cure a cancer. We don't.
No.
But we have advanced quite a bit to extend the life expectancy, to decrease the risk of cancer coming back.
So with the machine and the recording, it's very good. Because in the past, a doctor will tell you something and you don't really, you just have to take what he says. But no, we have the record clear. Everything is
Correct.
there.
So September 5th, we'll plan for the first round. So you are with us here almost half a day for chemotherapy.
Okay. September 5th, and the nurse will give me the training, right?
Correct. So the education will be sometime 1 or 2 days before you do the chemotherapy.
Mhm.
Somebody needs to bring you for the chemotherapy education also.
2 days, what date is the holiday?
Holiday is second, we could do third or the fourth, the chemotherapy education. And he'll be,
1 day before, okay?
1 day before is okay.
Okay, because we don't know what will happen after the holiday. Rush tonight.
So I will see you on the 4th of September, chemo teaching on the same day, and we start the treatment on September the 5th.
Okay.
On September the 4th, you need blood work. For every chemotherapy, you need blood work to make sure your blood numbers, the liver, kidney, everything is okay to give the chemotherapy.
And that will be done on September 4th?
September 4th. And the blood work lab is upstairs on the 4th floor. You go straight upstairs, do the blood work, and come down for the chemo, the teaching, and to see me.
So yes, I mean, before I see you, I really want to know what I can eat that can enhance my, because every time, most time when I make a visit, I have to do blood tests. So I feel like I'm
This
losing
is
all of
not
my
a,
blood.
this is not a fasting blood work. You never need to fast for my blood work, and for chemotherapy, you don't need to fast at all.
Okay,
You eat regularly the way you do and come here.
okay.
For CT scans that we do in the future, you may need to fast, but not for any of these.
Okay.
So commonly used chemotherapy for uterine cancer is a combination of 2 chemotherapy drugs. That is the standard of care all across the country. So that's what is recommended for your type. And I printed information on the chemotherapy drug. Actually, Taxel Chemocare. It's fairly well tolerated regimen. As I said, there will be some fatigue, some nausea. There will be some diarrhea related to chemotherapy. There are a lot of education about it, what to do when nausea happens, what medications to take, and all of that.
So before doing it, is there anything that I should prevent, like allergy related to food or any type of food or anything?
So we generally suggest avoid